Hello guys, welcome to the Grand Viva of Anatomein. So Anatomein is a pan-India anatomy quiz which was conducted by quizzical doctors. It was conducted on 14th June and many participants from different colleges across India have participated in this quiz. So we have conducted two rounds, round 1 and round 2. And on the basis of qualifiers of round 2, we have selected only 6 participants for the Grand Viva. And today we will take the grand viva of those 6 participants. So, out of the 6 participants, I will let you know the names of the 6 participants. So, the 6 participants are Swastik from AIMS Bhopal, Preksha from GMC Pali, Savneet Gill from AIMS Rishikesh, Sarvesh from JIPMER, Sanjeev Shaha from Murshidabad Medical College and Hospital, West Bengal, and Chera Cholapandian from JIPMER, Puducherry. So, guys, let's begin with the Grand Viva and see how it went. So hello guys, we are back again with the Grand Viva round of Anatomein, which is a quiz based on anatomy for Mbbs students. So in the Grand Viva round, we have 6 participants with us, and every participant will be asked 7 questions. And based on the marks, we will be choosing the winners. So let's start. So first we have Swastik, who is from AIMS Bhopal. So Swastik, going over to you. Can you introduce yourself?
Hi, my name is Swastik. I'm a second year MBBS student at AIMS.
Okay. So we are starting the Viva round. So first, I would like to go to Shubham, who is currently studying in Medical College, Kolkata. So Shubham, you can ask your first question.
Hi there, Swastik. So my question is going to be, what is the difference between pro-patency and a patent foramen novel? How will you differentiate between the two clinically?
So patent foramen will be like it develops normally, but it fails to close. Like normally after birth it closes, but if it fails to close after the birth, then we will call that a patent foramen novel.
So that is patent foramen novel or pro-patency of foramen novel?
So patent foramen novel.
Okay, and what is pro-patency of foramen novel in that case? Okay, and okay, so about patent foramen novel, can you give the clinical manifestation of that? Is that?
So basically it will form a gap between the right atrium and the left atrium. So mixing
Right,
of
I
both.
understand. Yep. Yeah, the next person can move on. Thank you.
Okay, okay, Swastik. Nice try. Now I would like to go to Parijat. She is currently studying in Bardhaman Medical College, West Bengal. So she will ask the second question to Swastik. Parijat, you can
Okay,
ask now.
so my question to you is, PEG cells are found in which layer of the fallopian tube?
Sorry, ma'am, can you repeat?
PEG cells are found in which layer of the fallopian tube?
Infundibulum.
No. Sir, time has gone. Next question.
Okay, Swastik. Nice try. You still have 5 questions left. So now I would like to go to Shorudeep, who is currently studying in Medical College, Kolkata, to ask the third question to Swastik.
Okay, Swastik, hope you have heard about hydrocele.
Sorry, sir, your voice was not clear.
Hope you have heard about hydrocele.
Yes, sir.
What is it?
So basically, it is the a disease in which fluid accumulates in the processus vagina, where there is a patent processus vaginalis. So there is a fluid accumulation in the scrotum.
Okay, so to remove the fluid, we have to use cannula trocar. So during using cannula trocar, what are the layers that it will traverse? What are the layers of this? It has to traverse during using cannula trocar. It is my question.
So basically, we have to firstly cross the layers of scrotum. Firstly, it will cross the external spermatic fascia, then the.
You can
one
first
layer.
tell about from outside to inside. From outside to inside.
So from outside to inside, firstly we will pierce the external spermatic fascia. Then the one layer I'm not remembering the name. Then internal spermatic fascia, and then we will reach the layers of the testes. So then will be tunica vaginalis.
Okay, nice try.
Okay, Swastik, nice try. So next question would be asked by Shampurna. She is currently studying in Medical College, Kolkata. So Shampurna, you can ask the fourth question to Swastik.
Okay, hi. So according to some theories, there is an organ in the human body which shows both open and closed type of circulation. Can you name which organ it is?
Ma'am, what about open and closed circulation? I was not able to hear properly.
There is an organ in the human body that shows both open and closed type of circulation. Can you name that organ, please?
Spleen.
Yes, good. So since it is a spleen, can you name some arteries in the order of their appearance in the splenic circulation?
Ma'am, firstly there is a trabecular artery, and it goes across the main channel of the spleen. Then it forms the central artery, and then it supplies along the periarterial lymphatic sheath, and then it forms the particular veins and supplies. I mean, basically supplies along the sinusoids, and
Okay.
from the splenic sinusoids, the veins formation occur, and then finally the splenic trabecular vein comes.
Okay. No, but now next we need to talk about the vein. Any other branches of the artery that you can name? You've named nearly all. Any other? It's okay if you can't. Don't stress about it.
I've read about it, but
Yeah, you've named almost all of them. Not a problem. What are diffuse and compact type of skin? If I'm saying diffuse and compact type of skin, what am I referring to? What am I talking
so
about?
diffuse and compact of what?
Spleen. Type of spleen. What am I talking about? If I'm saying diffuse and compact type of spleen.
Basically pulps, red and white pulp.
No, I'm not talking about this already. Diffuse and compact type of spleen. Like, what feature am I referring to when I'm saying diffuse and compact spleen? Again, it's okay if you can't. No problem. There's lots of questions here.
Okay, Swastik, your 4 questions are over. So now I would like to go to Shrav. He's currently studying in IPGMER and SSKM Hospital, West Bengal. So Shrav, can you ask the 5th question to Swastik?
Hello, Swastik. We know that there are some structure which are known as medullary rays in the medulla oblongata of the brain. Is there any other structure which has medullary rays?
So kidney.
Yes, right. And what are the structures which form the medullary rays?
So basically, the part after the renal calyxes and
Okay, nice try, Swastik. Next question, please.
Okay, Swastik, nice try. Now I would like to ask Shubhranil. He's currently studying in Medical College, Kolkata, West Bengal. So Shubhranil, you can ask the 6th question to Swastik.
Okay. Swastik, this is actually a case. You have to identify the case, what it is, and then the follow-up questions will then be asked. So listen carefully. A young man who had fallen off from a bicycle was brought to the ER with pain abdomen, and he was found to have not passed any urine. Upon clinical examination, it was found edematous scrotum with tender swelling of the lower part of the abdominal wall. So have you understood the question?
yes, sir. Basically, an accident happened and fluid accumulation is broken.
So the first question to you is, what is the space that I am talking about here? But what is the space that is involved? Okay. Your second question is, name the content that is a part of the space which I have talked about before. That is only a part of this space only, but not of the other space present in the perineum.
Sir, are you talking about any nerve?
Yes.
Sir, are you talking about any nerve or an artery? Like,
Yes, you are on the right track. Which nerve or artery am I talking about?
sir, sir, genitofemoral.
Unfortunately, that's the wrong answer. Would you have another try, or will I proceed to the next?
Sir, swelling was on which parts? Can you repeat?
There was an edematous scrotum with a tender swelling in the lower part of the abdominal wall.
So, ileoing one.
No, that's the wrong answer. Moving on to the last question. Give the names of the 2 unpaired muscle of the perineal body.
Sir, ischiocavernous.
No. There are 2 muscles which are unpaired and which contribute to the formation of perineal body. So you have to name those.
So, bulbospondylosis.
No, your tries are over and your time is also over. Over to the next.
Okay, Swastik, this is going to be your last question. That is the 7th question. So answer carefully. So now I would like to go to Shrutakirti. She is currently studying in Medical College, Kolkata. So Shrutakirti, over to you.
Hi. So my first question would be, what is the sympathetic innervation of the heart? You just have to name the plexus. Like you can name the level of the nerves.
T5 to T2 to T7.
That's not correct. So I would move on to the next question. Where is the cardiac ganglion located? You can try. It is around the aortic arch. If you can like name if it is related to the aortic arch.
Posterior to it.
No, that's not correct. Thank you.
So Swastik, it was a very nice attempt. So thank you for attending the Viva. Okay. Okay, bye, Swastik. You can means exit the call.
Okay, sir.
Am I visible now?
Yes, Preksha, you're visible now. So Preksha, you came second in our round 2 and you have qualified the Grand Viva along. You are in the top 6. So Preksha, I would like you to introduce yourselves to our audience.
Yes, my name is Preksha Gehlot, and I'm from Government Medical College, Pali, Rajasthan, and I'm currently a second-year student in that college.
Okay, Preksha, we will be starting with the questions. There are 7 questions, so we are starting with the first one. So first, I would like to go to Shubham, who is currently a studying in Medical College, Kolkata. He will be asking the first question to you. Over to Shubham.
Right. Hi there, Preksha. So my question is, what is the difference between pro-patency and patent foramen ovale?
Difference between pro-patency and
Patent foramen ovale. Ovale,
okay, so
ovale,
patent.
depending on your.
Okay, so basically these are the anomaly defects, and patent foramen ovale occurs due to the non-closing of the foramen ovale, and pro-patency is actually a condition in which the foramen ovale. Okay, pro-patency is I had heard it somewhere.
Okay, in case you don't know this one, it's fine. I can move on to the next question.
No, can I get 1 minute more to think?
I'm sorry, Preksha, there's a time limit.
Okay. Okay. Actually,
my
it is a
next
defect in the heart that didn't close. It should have gone closed after the birth. But okay, so next question. We'll move on to
Yeah, the next question is kind of related to this one. What is the clinical differentiation between these two? So, would you be able to answer that? Pro-patency and patent foramen ovale? No? Okay, it's fine, Preksha. Move on to the next question, please.
Okay, Preksha, it was a nice try. Now, Parijat, who is currently she's studying in Bardwan Medical College, West Bengal, she will be asking you the second question. So over to Parijat.
Okay, so Preksha, my next question to you is, PEG cells are found in which histological layer of the fallopian tube?
Sorry. What?
Did you not hear? Okay, I'm telling it once again. PEG cells are found in which histological layer of the fallopian tube? You know the answer? Your time limit is over, Preksha. If you know, you can tell.
Is it? These are found in the columnar epithelium. Like these are the columnar epithelium which are found.
No, I'm telling in which histological layer. There are 3 layers of the fallopian tube now.
Mm-hmm.
Okay, Parijat, the time is over.
Okay, so next question.
So Preksha, no worries. You still have 5 questions left. So now I'd move on to Shorodip, who is currently studying in Medical College, Kolkata, West Bengal. So Shorodip, over to you for the third question.
Hi Preksha, what is hydrocele?
Question बोल दिया क्या? Hello.
Hello, what is hydrocele?
Hydrocele, it is like मतलब fluid fill sac हो जाता है testes के around, and swelling show होती है scrotum में, and मतलब newborns में generally anomaly defect भी हो सकता है, generally बिना treatment के भी ठीक हो सकता है, but age के साथ भी develop होता है hydrocele, older men में भी हो सकता है.
कौन सा layer can you tell about it? कौन सा layer होता है testis का?
Yes.
You are correct. कौन सा layer होता है क्या?
Tunica vaginalis.
Yes. You are correct. Your next question is for removing the fluid from the tunica vaginalis, we have to use cannula or trocar. So during inserting cannula. Okay. So during inserting the cannula, what are the layers the cannula will traverse to reach tunica vaginalis? What are the layers?
Layers is layers. Okay. We'll have to go through the skin firstly, then then the external, then the dartos muscle.
Yes.
Then the external spermatic fascia.
Yes.
Then external spermatic fascia, then cremastic muscle, then internal spermatic fascia, and then tunica vaginalis.
Okay. You are correct.
Okay, Preksha, nice. So now I would like to move to Shampurna. She is currently studying in Medical College, Kolkata, West Bengal. So Shampurna, can you ask her the fourth question?
Okay, so my first question is, according to some theories, there is an organ in the human body which shows both open and closed type of circulation. Could you name that organ?
It is spleen.
Yes, it is spleen. So
Yes.
while we're on the topic of spleen, could you name the order of the arteries, the names of the arteries in their order in which they appear in the spleen circulation? So the splenic artery enters and then the branches in their order. Only the arteries. No need to name the veins.
So we have to go in order like splenic
मतलब
artery comes.
हाँ
फिर उसके दो divisions, anterior and posterior divisions.
अच्छा हुआ फिर मतलब
And
स्प्लीन के
then
अंदर जो होता है माइक्रो सर्कुलेशन उसमें तो कुछ नेम ब्रांचेस आते हैं ना कुछ बोलते हैं हम वो अगर नेम्स हो सके तो
particular names जो micro circulation के अंदर आते हैं.
हाँ मतलब टाइप्स ऑफ आर्टरीज में वो जो ब्रेक करे वो थोड़ा अगर कह सके तो
Okay.
अगर नहीं हो तो ठीक है कोई क्वेश्चन नहीं है
एक सेकंड मैं सोच लेती हूँ. जैसे ट्रेबिकुलर आर्टरी होती है एक.
हाँ एक है ट्रेबिकुलर आर्टरी एक है.
हाँ.
फिर
फिर वो आगे जाती है और मतलब जैसे वो टी सेल्स होते हैं हमारे जो
हाँ
उनको
हाँ
उनके
हाँ
उनको सराउंड करती है मार्जिनल आर्टरीज बना के. उसके
अच्छा
बाद
तो मार्जिनल आर्टरी तो नहीं कहते मतलब
अच्छा.
कुछ कहते हैं उसका कुछ नेम है फिजियोलॉजी में
ओके
बहुत
तो
कॉमन फीचर है ऑलमोस्ट टाइम अप हो रहा है इस क्वेश्चन का तो ट्रेबिकुलर आर्टरी कह सकी और कुछ
और पेनिसिलर आर्टीरियल भी होती है एक.
हाँ होती है ठीक है
हाँ.
अच्छा अच्छा नेक्स्ट क्वेश्चन if I'm talking about diffuse and compact types of spleen, what am I referring to? What do I indicate when I say diffuse and compact type of spleen?
लाइक कुछ डिजीजेस में
It's not
ये
pathological.
जो
It's not
पाल्स जो
pathological.
होता है पाल्स
हाँ
पेरी
पल्स
आर्टीरियल
के बारे में नहीं पल्स के बारे में नहीं
इसके अलावा तो आइडिया नहीं मुझे पल्स ही लगता था.
ठीक है वेल डन
Okay, Preksha, nice attempt. Now I would like to go to Shrav, who is currently studying in IPGMER and SSKM Hospital, West Bengal, to ask Preksha her next question. Over to you, Shrav.
Hello, Preksha. We know that there are some structures known as medullary rays in the medulla oblongata of the brain, right? Is there any other structure which has medullary rays?
Yes, in kidneys.
Yeah, right. So, what are the structures which form the medullary rays?
Renal lobule.
No, there is a special type of nephron that forms it.
Those juxtagranular nephrons.
Yeah, which part of them?
The particularly part which dips into like the vasa recta.
The vasa recta is a vessel. So, what part of the nephron dips into the medulla?
The medullary part itself, like जो medulla में dip होता है vasa recta.
What is the name? What is the name of the part that dips into the medulla? Okay, Preksha. You have done a great attempt. Thank you. Move on to the next question.
Okay, Preksha. So now I would like to go over to Shubhronil, who is currently studying in Medical College Kolkata, to ask the sixth question to you. Over to Shubhronil.
Hi, Preksha. So this is actually a case. You have to identify what is the case which I am stating, and then the follow-up questions will be asked. A young man who had fallen off from a bicycle was brought to the ER with pain abdomen and was found to have not passed any urine in the last 24 hours. On clinical examination, there was edematous scrotum with tender swelling of the lower part of the abdominal wall. So this is the case. So your first question, name the space which I am talking about. Do you know the answer? Your time's nearly over for the first question. Moving on to the next one.
Can you once repeat the case again?
So I'm just highlighting the main points. एक बंदा था साइकिल से गिर गया उसका गिरने के बाद उसका एब्डोमेन में बहुत पेन हुआ उसको ईआर में लेके गया तो वहां पर उसका इडीमेटस स्क्रोटम था और स्वेलिंग था इन द लोअर एब्डोमिनल वॉल. So your first question was what was the space that was involved? Okay, your time's up for the first question. Moving on to the next one. Name the content which is only a part of the space which I have described above, but not of the other space present in the perineum.
अच्छा, of the space. Like the superior rectal vessels?
No, you are absolutely wrong. Moving on to the next question, the last one from my side. Give the names of the two unpaired muscles contributing to the formation of the perineal body.
Hello.
Yes, Preksha, you're audible. You can say.
Hello.
Yes, Preksha, you're
दिख
audible.
नहीं
You
रहे.
can say.
I think
Okay. So now we move on to the last question of Preksha. Now I'd like to move on to Shruta Kirti, who is studying currently in Medical College, Kolkata. So Shruta Kirti, over to you.
Hello.
As Preksha cannot hear us, so can you just type your question to Preksha?
Okay, sure.
Saurabh, please ensure you can see the messages too, because if it's a net problem,
हाँ ये messages आप अगर कुछ hello मैं WhatsApp कर देती हूँ आपको.
I don't think she can see the messages.
Okay.
Maybe
So
you can.
Manish, can you once add her again? তাড়াতাড়ি করতে বল.
Okay.
এই তো she joined. Hello Preksha.
Yes, now you all are visible. I can hear you.
Yes. So Preksha, this is your last question. This is going to the 7th question. So over to Shruta Kirti.
What was the second last question then?
It's over. Your time is over for the 6th question.
Okay, what was it actually? I will not answer it, but what was the question?
Shubhram, can you repeat the question to her once?
the question was give the names of the two unpaired muscles contributing to the perineal body.
Okay, unfilled muscles of the perineal body.
Sorry,
Okay, so
I can't hear.
Okay. Moving on to Shruta Kirti. Ask her the 7th question, please.
Hi. So the 7th question, two parts. First part is, what is the sympathetic innervation of the heart? You just have to mention the levels.
Okay, so just mention the levels. Like the plexuses that are formed from superior cervical ganglion, then middle, then inferior, and then from T1 to around T12. All them they form the superior, and like the superior cardiac plexus and the inferior cardiac plexus. The superior cardiac plexus is formed only by the vagus recurrent laryngeal, and okay, so that forms a part of the parasympathetic. So okay, it's only from T1 to T12 and superior, middle, and inferior cervical ganglion.
Okay, thank you. And for the next question, you have, where is the cardiac ganglion of Risberg located?
Where's the cardiac? Cardiac?
You know, cardiac ganglion of Risberg. So it's related to the aortic arch.
Okay. Yes, it is related to the aortic arch. So, like in the aortic, around that aortic arch, it is attached to the left recurrent laryngeal nerve. It attaches to that, and I know this much about that. I cannot hear anyone now. I can't hear anyone.
Shruta Kirti, you are mute. You are muted.
No,
Maybe
Shruta
turn
Kirti,
on
we
your
can.
mic, please.
Hello, Shruta Kirti, you're muted.
Hello?
Yes.
Yes,
You're audible.
Sorry for that. I'm going to repeat it. It is related to the aortic arch. Okay, so if it's anterior, posterior, superior, inferior, you have to say like that.
Okay, in that case, probably it might be this one.
Okay, Preksha, I think your time is over.
Superior.
No, but it was a good attempt.
Okay, thank you.
Okay, Preksha, your questions are over. You have attended them nicely. So, Preksha, thank you for participating in our quiz. Wish you best of luck for your future. Thank you, Preksha. You can leave the session now. Hello, Savneet.
Hello, good evening, sir.
Yes, Savneet. So, Savneet, welcome to the Grand Viva of Anatomein. Congratulations for qualifying round 2. You are in Grand Viva now. So, Savneet, as I can see, you are from AIIMS Rishikesh. Can you introduce yourself to the audience?
I'm Samneet Kaur Gill. I'm from AIIMS Rishikesh, currently pursuing currently in the MBBS first year.
Okay, Savneet, nice. So, Savneet, 7 questions will be asked to you. So, can we start?
Yes, sir.
Okay, Savneet. So, first, I would like to go to Shubham. You can ask the first question to her.
Right. Hi, Savneet. So my question to you is going to be, what is the difference between propatency and patent foramen ovale?
Propatency?
And patent foramen ovale.
Sorry, sir. I don't know this.
Okay, so my second question is related to this. How will the two differ clinically? So you have a baby of propatency and a patent foramen ovale. How will you differentiate between them clinically?
Sorry, sir. I'm not aware of propatency.
Right. Moving on to the next person.
Okay, Savneet, no worries. You still have 6 questions left. So now I'd like to go to Parijat. Parijat, over to you. Ask her the second question.
Okay, so my question to you is, a fallopian tube has how many histological layers, and can you please name them?
Okay. So for fallopian tube, first of all, we have ciliated columnar epithelium, followed by ciliated columnar epithelium. Then it is followed by Submucosa,
Layers, name of the layers.
fallopian tube.
Yes. It's covered by 3 layers.
Adventitia, and followed by submucosa and then ciliated columnar epithelium.
Oh no, you're not getting it right. Okay, so moving on to my second question. Peg cells are found in which layer of the fallopian tube?
Egg cells. Sorry, ma'am, I'm not aware of this.
Okay, nice try. So moving on to the next person.
Okay, Savneet. So moving on to the third question, I would like to tell Shoradeep to ask her the third question.
Hi, Savneet. What is hydrocele?
Hydrocele is the accumulation of the fluid.
Where? Which organ?
In the amniotic cavity, the fluid is accumulated. Sorry, I'm sorry. Hydrocele is the accumulation of fluid in the peritoneal cavity.
Which organ?
Sorry, what are you asking?
Which organ? Which organ? Which organ?
Which organ? Urinary bladder. Not urinary bladder. Sorry, I'm sorry. Just please give a minute. Peritoneal cavity. Hydrocele is the accumulation of fluid in the.
Okay, your time is over. My next question is for removing the fluid from the hydrocele organ, we have to use cannula. For removing the fluid, we have to use cannula. So, what are the layers the cannula will traverse to reach this structure, to reach the organ?
First of all, skin, then superficial fascia, then external oblique, internal oblique, transverse abdominis, fascia transversalis, extraperitoneal tissue, peritoneum.
Okay, nice attempt. Thank you.
Okay, Savneet. Now I'm moving on to your next question. So going over to Shampurna, please ask her the next question.
Hi, Sajnik. My first question is, there is an organ in the human body which, according to various theories, has both open and closed type of circulation. Could you please name that organ? Sorry, can you please speak a bit louder? Okay, so in the human body, according to some theories, there is both open and closed type of circulation. Could you please name that organ? Liver. No, that's not correct. It's okay. In splenic circulation, could you please name the order of the arteries? So the arteries in the order in which they come in splenic circulation. In splenic circulation, first of all, splenic artery, then hilar arteries. Yes. Then. Sorry, I don't remember. Okay, it's fine. So when I say a compact and a diffuse type of spleen, what am I referring to? If I say compact and diffuse type of spleen, what am I referring to? It differs based upon the arterial supply. Like it is based upon how the branches are arising. Okay. Could you elaborate a bit more on that? Anything at all. So arterial supply, like, what are we seeing? In one of them, the branches will be coming directly from one common artery, that is the splenic artery. In another, first of all, the artery will be entering into the spleen, and then some branches will be arising. Okay. Nice try. Okay. Moving on to the next.
So Savneet, nice try. Now we are going to your fifth question. So I'd like to go over to Shrav for asking Savneet her fifth question.
Hello, Savneet. We know that there are some structures which are known as medullary rays in the medulla oblongata of the brain. Is there any structure which is medullary rays? Other structure?
Any other structure which is similar to medullary rays?
Which has medullary rays?
Which has medullary rays? Kidney, we say, to the collecting ducts, we refer to the medullary rays.
Yeah, so what are the structures which forms the medullary rays?
It is basically formed by the collecting ducts.
Collecting ducts only?
Collecting ducts and...
Collecting duct may be present. What are other structures which are present mostly?
Collecting tubule.
No.
And
no.
I'm just aware of the collecting ducts mainly.
Achha, there is a special type of nephron that forms that medullary ray.
Juxtaglomerular.
Yeah. Right. So what part of that nephron?
What part of that nephron is forming the medullary?
Right.
For me, still I'm going with collecting ducts of those juxtaglomerular nephrons are responsible for loop of Henle.
Yeah.
Loop of Henle, sorry.
And some other vessel that forms it?
Vasa recta.
Right. Okay. Good. Next question, please.
Okay. Hi, Savneet. I will be asking you a case, and you have to answer the follow-up questions to that. A young man who had fallen off from a bicycle was brought to the emergency room with pain abdomen and was found to have not passed any urine for the last 24 hours. On clinical examination, he has an edematous scrotum with tender swelling of the lower part of the abdominal wall. So my first question to you is, what is the space I am talking about here in the perineum?
Superficial perineal pouch?
Yes, that's absolutely right. The second question, So you know that there are two pouches, the superficial and the deep one. So name a content which is a part of only the superficial pouch but not of the deep pouch.
Only the content of superficial pouch and not of the posterior scrotal nerves and vessels.
Absolutely right. The third question, give the names of the two unpaired muscles of the perineal body.
Names of two?
Unpaired muscles of the perineal body.
Sphincter urethrae and sphincter urethrae. Pulbospongiosus.
No, that's both of them are incorrect. You can have another try at that one.
Two unpaired muscles of the two unpaired muscles of perineal body, two unpaired muscles at the
Savneet, I'm sorry, but your time's up. So we have to move to the next question.
Okay, Savneet, this is going to be your last question. This is the seventh question. So I would like to move on to Shruta Kirti. Please ask her the seventh question to her.
Hi. So your first question would be, what is the sympathetic innervation of the heart? I just want to know the levels of the plexus. Okay. Like if you want to say T1 to T6, that should be the pattern of your answer.
Sorry, you want to know?
The sympathetic innervation of the heart.
Okay. It is T1 to T5.
Very good. You're correct. You're absolutely correct. So for the next question, do you have any idea where the cardiac ganglion of Risberg is located?
Cardiac ganglion of
Risberg. Forget Risberg, just cardiac ganglion.
Below the arch of aorta?
Very good. So both answers are correct. And I think that's it from my side. You can move on.
Okay, Savneet, your 7 questions are over. So thank you, Savneet, for participating in Anatomein. Your performance was really very nice. So Savneet, good best of luck for your future. Now you can leave the session, Savneet. Thank you. Hello, Sarvesh. Hello.
Also, can you hear me? Also, can you hear me?
Yes, Sarvesh, you're audible. Can you please turn on the video?
Yeah,
Yes,
can you
yes.
see me, sir?
Yes, Sarvesh. So, Sarvesh, you are from Chipmar, Puducherry, right?
Yes, sir.
Yes, Sarvesh, can you introduce yourself to us?
So, I'm Sarvesh from Viva Pondicherry. I completed my 12th standard in Bangalore.
Okay, Sarvesh. Sarvesh, you are not visible properly.
Now, sir?
Yes, yes, now perfect.
Yeah.
So, Sarvesh, we are starting with the questions. You will be asked 7 questions. Okay.
Okay, sir.
And for each question, you will get 30 seconds time. Okay. So, we are starting with the first question. So, first question will be asked by Shubham. Over to Shubham.
Hi there, Sarvesh. So my question is going to be, what is the difference between probe patency and patent foramen ovale?
Okay, sir. Okay. Could I take 30 seconds to think?
Excuse me?
Could I take 30 seconds to answer?
Yeah, sure. 30 seconds is actually your time limit.
Yeah, so can I say the answer now, sir?
Yeah, sure. Just answer whenever you can.
Yeah, so basically regarding the embryology development of heart, what happens is there are two septums, septum primum, septum secundum. There should be a fusion, like the septum primum, which is the crescent shaped thing, and then the septum secundum, which is like a flap over it. So septum secundum must close on it like a flap, and this, if it's closed, then it will form foramen ovale and limbus post ovalis on the other side. If this closure at all doesn't happen, then it is patent foramen ovale. But if the fusion happens, but there's still a small gap because of other operations, then it is pro-patent, because when you leave a probe through your IUD, you're able to reach the FACS.
Right, that is very much correct. Very good. My second question is, how will you clinically determine this? You have two patients, one has probe patency, the other has patent foramen ovale. What is the difference between the clinical manifestations which the patients will present?
So probe patency will not manifest itself very early, whereas patent foramen ovale will definitely manifest itself early.
Yes. And just as a bonus, can you name the syndrome which will happen in patent foramen ovale?
In patent foramen ovale, you have no clue, sir.
Still fine, Sarvesh. That is blue baby syndrome. Very well answered.
Okay, Sarvesh, moving on over to your next question. So I'd like to ask Parijat to ask Sarvesh his second question.
Okay, so Sarvesh, my first question to you is, a fallopian tube is covered by how many layers?
Okay,
Can you name them?
Okay, ma'am. So basically, I'll take 20 seconds to answer. 10 seconds, please.
Yes, that is the limit.
Yes, ma'am. So basically, a fallopian tube is a part of the female reproductive system, which is considered to be covered by a perineum on both sides. Basically, the broad ligament of uterus system overlaps, like the fallopian tube is here, it overlaps, it's first like a curtain over the entire fallopian tube. So what happens is there are actually two, like both anterior and posterior, you have the broad ligament. It is called mesosalpinx in this case, and
Continue.
yeah, it's called mesosalpinx in this case. So yeah, you call Mr. case, and then the tip, like wherever the isthmus is there, where it goes and joins the uterus, there are three more. Like there is broad ligament of uterus, there is broad ligament, there is broad ligament of uterus, broad ligament of uterus, and in between you have a fallopian tube. So basically, there are same thing of the the same, but the way is different regions.
Okay. So you have answered it correctly. So I want to ask you, PEG cells or secretory cells are found in which layer of the fallopian tube?
Could you please repeat, ma'am?
PEG cells or secretory cells are found in which layer of the fallopian tube?
The secretory cells are found in the so the submucosal layer.
No, Sarvesh.
I'm not sure, ma'am.
Okay. You have nicely attempted it. So moving on to the next person.
So going over to Shorodip, ask him his third question.
Sarvesh, what is hydrocele?
I can't hear you properly.
What is hydrocele?
Okay, sir. Hydrocele. Yeah, I tell you. Hydrocele, I'm not sure if what I'm saying is exactly correct, but then hydrocele is basically it's an embryological defect in the anti-abdomen where you have a pouch of fluid which is like protruding out. It's different from omphalocele in that there's no gastric contents inside, but then you have a fluid retention there in the pouch.
Which layer? In which layer the fluid is there? In hydrocele, which organ? Which organ?
Okay. Is it in the small intestine, sir?
Yes, you are not audible. Can you repeat?
Sir, is it in the small intestine?
No, Sarvesh. Okay. The next question is, to remove the fluid from the organ, we have to traverse some layers with the help of cannula. Okay. So can you name the layers that the cannula has to traverse to clear the fluid or to remove the fluid?
So basically skin, superficial fascia, both the layers of superficial fascia, and then you go to the external oblique, internal oblique, fascia transversalis, and then you go in and parietal peritoneum, the visceral fat, and then you can access the organ.
Okay, Sarvesh, good attempt.
Okay, Sarvesh, nice. Now I would like to ask Shampurna to ask Sarvesh's fifth question.
Okay, so
Sorry, fourth
Sarvesh,
question.
according to some theories, there is an organ in the human body which has both open and closed type of circulation. Could you please name that organ?
Both open and closed type of circulation.
Yes.
Can I explain that for liver?
No, it's not the liver, but it's okay. So it's actually the spleen. Okay.
Yeah, okay, you told the answer. Please.
Okay. So because my next question is related, in the splenic circulation, after the splenic artery enters into the spleen, could you name the branches it gives?
Ma'am, first the splenic artery enters, which then divides into the lobular branches, which gives the segmental branches and then the penicilline artery. So now this penicilline artery will finally go and form the cause of Billard. The cause of Billard, which is the red pulp of spleen, basically means that you have this arteriole going, around that you have clusters of lymph nodes, clusters of WD, like lymph nodules present there. So this gives like a cord appearance, it's called cause of Billard in spleen.
Okay, so between the segmental arteries and the penicillin, could you please spell the branch which you named after the segmental arteries? The spelling? What is the spelling?
Of the segmental, I said penicillin, I said PENICILLAR, and then I said cause of Billard.
Okay, it's fine. So between the segmental and the penicillin branches, is there any other branch you would like to name?
Segmental.
It's okay if you can't.
Interlobular, ma'am? No, I'm not sure. I'm not sure.
No, it's not interlobular. It's okay. So my next question is, if I say compact and diffuse type of spleen, what am I referring to when I say compact and diffuse type of spleen?
So, is it the like presence of the ligaments which maintain its place and thus determining the?
It's not related to the ligaments. You can try again. It's not related to the ligaments.
Type of the blood supply, ma'am?
It refers to the blood supply. What are we saying apart from what which blood supply are you saying?
Okay, so compact type of spleen basically means a single splenic artery actually goes and then into the hilum and then directly to the branches. Whereas diffuse type of spleen, like in the ligament which connects itself, you have various branches which go on perforate.
Okay, well answered. Good answer.
Okay, Sarvesh. Now it's time for your fifth question. So I'd like to ask tell Shrav to ask Sarvesh's fifth question. Moving over to Shrav.
Hello, Sarvesh.
Yes, sir.
We know that there is some structure known as medullary rays in the medulla oblongata of the brain. You know them?
Medullary?
Yeah, medullary rays.
Rays, RAYS.
Medullary RAYS, yeah.
Okay, sir.
So is there any other structure which has medullary rays in them?
You have medullary rays in the kidney, sir.
Yeah, right. So,
So basically, what are they?
what are they?
The kidney is basically how they are capsules, which includes the cortex. Further down the cortex, you have a medulla. In the medulla, you have a medulla arranged as pyramids, like the medullary pyramid arranged. Now, there are actually the parts of cortex which project in, is not columns converted, but there are also columns of medulla which actually project out from the base of the pyramid to the capsule, like to the surface of the cortex. These are called medullary rays. It's a very radiation.
So, what are the structure that forms them? What are the microscopic structure that form them?
Medullary rays are mainly formed by the proximal distal convoluting tubule.
Sorry?
The proximal distal convoluting tubule, mainly even the collecting duct. The collecting duct mainly goes as follows the belly. So it's mainly the proximal distal convoluting tubule, PCT and DCT.
No, it's not that. Would you like
There is the loop of Henle, sir.
Right, loop of Henle from them.
Okay.
And is there any other vessel that form them?
Vaca recta, the counter current maintain order.
Right. So, is there any special name of the nephron which form that medullary ray?
So because it's in the medulla, it has to be, it can't be juxtamedullary. It is juxtamedullary, not cortical.
Yeah.
Okay, Sarvesh, nice. Now I'd like to go over to Shubhronil so that he can ask Sarvesh his sixth question.
Hi, Sarvesh. I'll be asking you a case which you have to carefully listen to, and then I'll ask you some follow-up questions to that. So the case is a young man who had fallen off from a bicycle was brought to the emergency room with pain abdomen and was found to have not passed any urine in the last 24 hours. On clinical examination, there was an edematous scrotum with tender swelling of the lower part of the abdominal wall. So now the first question: what is the space that I am talking about in the perineum?
So since you're saying the scrotum has become edematous, you're talking about superficial perineal pouch.
That's absolutely right. The second question: name the content which is a part of the superficial pouch but not of the deep pouch.
Part of superficial perineal pouch, but not of the deep pouch. So we can say the last part of urethra.
No, it's not actually urethra. It's actually a nerve or a vessel. So you can have another attempt.
Our vessel is not a part of deep, but a part of, okay, it is shown with the so is it the deep artery of penis and in the back we put in lab, so the deep artery of penis and
No, that's incorrect. Moving over to your last question from my side. Give the names of the two unpaired muscles contributing to the perineal body.
to unpack muscles contributing to the perineal body.
You know, there in the perineal body we are both paired and unpaired. So give the names of the unpaired muscle contributing to the perineal body.
Yes, sir. The levator and levator is as such a loop, right? So it's not fat muscle.
There are two muscles. Please give me the names of the two.
Okay, one minute. I think those forgot, I can't recollect it.
Sorry?
Sir, I don't know. I forgot and I'm not able to
Okay, that's absolutely perfect.
Okay, Sarvesh, now this is the seventh question. This is going to be a last question, okay? So I'd like to go over to Shrutakirti so that she can ask Sarvesh his last question. Hello?
Yes, sir.
Hello, Shrutakirti? Hello? Shrutakirti? You're not audible and visible. Okay, I think she has lost her connection. So I would like to tell Shampurna if she can ask Sarvesh his last question.
You want me to ask another question?
Yes. As Shrutakirti is not there, so you can ask the question.
Okay, just a minute. So, in the splenic circulation, we talked about the peninsular arteries, right?
Yes.
So, before that or during the course of the peninsular arteries, there are some thickenings present. Could you name those thickenings? Some thickenings along the course. Hello?
Yes, I can hear you.
Hello.
Yes.
Yes, Shrutakirti is back. Okay. Sarvesh, this question will not be considered. Okay. Now you'll be asked the seventh question. Okay.
Okay, sir.
Yeah,
Shrutakirti,
my
you're not
question.
visible. Okay.
Okay. So the net connection is a bit problematic over here.
Okay,
That is
no
why.
problem. Okay.
Okay. So my question is, you have to tell me the sympathetic innervation of the heart. Like the level.
So
Okay.
the level.
Yeah, if you think it's C3 to C6, you have to say it's C3 to C6.
Okay. So basically the heart supplied by sympathetic nervous system, like majorly sympathetic nervous system is from two plexus, the superficial and deep cardiac plexus. Both of them, like superficial cardiac is also part of which is located just in front of the bifurcation of the aorta. So what happens there is from there you have the vessels, the nerve supply from one second. T1, yeah, T1 to T6 if I'm not wrong, ma'am. And
1 second. Did you say T1?
no, ma'am, T2,
Okay, T2 to?
T6.
Okay, and okay, that's it for this question. And my second question for you is, where is the cardiac ganglion of the wristburg situated?
Yes, and the cardiac ganglion wristburg, also called the superficial cardiac plexus ganglion, is actually present just underneath the bifurcation of the trachea. The trachea divides into two, just underneath that is there, then above the arch of aorta.
Above.
There's a trachea bifurcation and then there's an arch formed around it. So it's like under, what do you say, like, under the cave formed by the arch of aorta.
Okay, yeah, you're right. Nice. So we can move on from here.
Sir, I can't hear you.
Saurabh, you're muted.
Sir, I can't hear you, sir.
Saurabh, please turn on your mic.
Okay. Sorry, it was muted. So Sarvesh, your 7 questions are over, and thank you for joining with us. Wish you all the best for your future. Okay, now you can leave the session. Thank you.
Sure, sir, thank you.
Yes. Shunjib, hello Shunjib. Hello.
Hello.
Yes, Shunjib, you're not visible. Can you turn on your video?
Yes.
Shunjib, your video is not turned on. Can you just check? Yes, perfect. So, Shunjib, as I can see, you are from Murshidabad Medical College and Hospital.
Yes.
So you have qualified round 2 and you're in Grand Viva now. So, Shunjib, introduce yourself to the audience.
Myself, Sanjay Shah. I am a student of Murshidabad Medical College and Hospital, and I am currently pursuing Mbbs and first year.
Okay, Shunjib. So 7 questions will be asked to you, and your time you'll get is 30 seconds for each question. So Shunjib, we are starting with the questions, okay? Okay, so first I would like to go to Shubham. Can you please ask him this first question?
Yes, hi Sanjeev. My question to you is, what is the difference between probe patency and patent foramen ovale?
Patent foramen ovale means when there is not fusing of the septum primum and septum secundum.
Right, that is patent foramen ovale. And what is probe patency of foramen ovale? Okay, so I'll move on to the next question. How will you clinically differentiate between a case of probe patency of foramen ovale and a patent foramen ovale?
No, pass.
Okay, next question.
Okay, so I would like to go over to Parijat so that she can ask him his second question. Over to you, Parijat. Hello, Parijat. Okay. She is having some problems. She has written the question in the chat. I am reading it for you. 1 second. So she has asked, fallopian tube has how many histological layers? Can you name them?
No.
Okay. No problem. So I would like to now go over to Shorodip so that he can ask him this third question. Okay. Wait. Parijat has her next question. Okay, Parijat, you can write it. Okay, Parijat, type the next subpart of the question. PEG cells are found in which layer?
Pass.
Okay, fine. So now the third question. So Shorodip, over to you.
Hi Sanjeev, what is hydrocele?
Accumulation of fluid in the that is tunica
Yes.
accumulation of fluid in the parietal layer and the visceral layer of the tunica vaginalis in the scrotum.
Absolutely correct. So to remove the fluid from the tunica vaginalis, we have to use cannula. So can you just name the layers that cannula should traverse to reach the tunica vaginalis?
Skin, then skin, then the dartos muscle.
Yes.
And then
you are correct. Next layers.
The parietal layer of the tunica vaginalis, and then we can drain the fluid.
Okay. Good attempt.
Okay, so Sanjeev, now I'd like to move over to Shampurna so that she can ask you your fourth question.
Okay, Sanjeev, hi. My first question is, according to some theories, there is an organ in the human body which shows both open and closed type of circulation. Could you please name that organ?
Will you please repeat the question?
According to some theories, there is an organ in the human body which shows both open and closed type of circulation. So, she organ का नाम बोलो, यदि पारो. Open and closed दोनों type of circulation है. Perfect.
No.
ठीक है. So the next question is in the splenic circulation, the splenic artery enters the spleen and then we get a lot of branches one after the other. So in the order of their appearance, could you name the branches? Branches का नाम.
No.
मैंने नहीं मैंने पूरा ब्रांच का नाम बताइए splenic artery.
till render the splenic artery proper. That's not right.
হ্যাঁ আচ্ছা ঠিক আছে অসুবিধা নেই। আচ্ছা আমি যদি বলি if I say যে compact and diffuse types of spleen, compact and diffuse type of spleen যদি আমি বলি তার মানে কি? What do you mean by that? Compact and diffuse type of spleen কি what am I referring to, মানে কি বেসিসে আমি বলছি এটা compact and diffuse? ঠিক আছে nice attempt.
Okay, nice attempt, Shunjit. Now I would like to ask Shrav to ask Shunjit his fifth question. Over to you, Shrav.
Hello, Sanjay.
Yes.
We know that there are some structures known as the medullary race in the medulla oblongata of the brain. Is there any structure which also has medullary race? কোন অর্গান আছে যেখানে আছে এটা মেডুলারি রেস?
Bone, like
No. What are the solid organs in the abdomen? Abdomen solid organs গুলো কি বল?
the organ গুলোই তো।
ওকে, তার মধ্যে কোন অর্গানটা মেডুলারি রেজ আছে ও আস্ক করতে চাইছে?
ঠিক আছে, your time is up.
ঠিক আছে, টাইম ইজ ওভার।
Thank you.
ওকে ঠিক আছে। সো নাও আই উড লাইক টু গো টু শুভ্রনীল। প্লিজ আস্ক হিম হিজ সিক্স কোয়েশ্চেন।
আচ্ছা, আমি একটা কেস পড়বো, সেই কেসটা শুনে তোকে তার ফলো আপ কোয়েশ্চেনগুলোর অ্যান্সার দিতে হবে। A young man who had fallen off from a bicycle was brought to the ER with pain abdomen and was found to have not passed any urine. সাইকেল থেকে পড়ে গেছে, পেটে ব্যথা আর 24 ঘন্টায় কোনো পেচ্ছাপ করেনি। On clinical examination, edematous scrotum with tender swelling on the lower part of the abdominal wall. তাহলে আমি ফার্স্ট কোয়েশ্চেন হচ্ছে যে নেম দ্য স্পেস দ্যাট ইজ ইনভলভড ওভার হিয়ার। কোন স্পেসের কথা আমি বলছি পেরিনিয়ামের?
আরেকবার রিপিট করবে?
সাইকেল থেকে পড়ে গেছে, পড়ে গিয়ে পেটে ব্যথা, 24 ঘন্টা ইউরিনেশন হয়নি, দেখা গেছে এক্সামিনেশনে ইডিমেটাস স্ক্রোটাম মানে স্ক্রোটাম এডিমা হয়েছে আর লোয়ার অ্যাবডোমেনে সোয়েলিং আছে। সো এটাতে মানে কোন স্পেস, পেরিনিয়ামের কোন স্পেসের কথা বলছি?
পাউচ,
আরেকবার বল।
সুপারফিশিয়াল পেরিনিয়াল পাউচ।
ঠিক আছে, নেক্সট কোয়েশ্চেন, নেম দ্য কন্টেন্ট যেটা সুপারফিশিয়াল পাউচের পার্ট বাট নট আ পার্ট অফ ডিপ পাউচ।
কন্টেন্ট বলতে হয় তো?
হ্যাঁ,
ইসিও ক্যাভার্নোসাস ভালভাস কনজোসাস।
না আমি বলছি এমন একটা কন্টেন্ট বলো যেটা সুপারফিশিয়াল পাউচে আছে বা ডিপ পাউচে নেই। ঠিক আছে, লাস্ট কোয়েশ্চেন, গিভ দ্য নেম অফ দ্য টু আনপেয়ার্ড মাসেল কন্ট্রিবিউটিং টু দ্য পেরিনিয়াল বডি। পেরিনিয়াল বডি ফর্মেশনে যে দুটো আনপেয়ার্ড মাসেলের নাম সেটা বল।
এক্সটার্নাল ইনার স্ফিংক্টার, ভালভাস কনজোসাস।
না, সেকেন্ডটা আরেকবার ভেবে বল। ঠিক আছে, টাইম আপ হয়ে গেছে।
Okay, Shunjit, no problem. Now I would like to ask Shrutakirti to ask Shunjit his seventh question, and Shunjit, this is going to be the last question. Okay, so hear it carefully. So over to Shrutakirti.
Hello.
Yes.
I hope I'm audible. Okay, so
Yes,
the first
yes,
question is, what is the sympathetic innervation of the heart? You have to mention the levels of the nerves. Okay.
T1 to T5.
Yes, you're correct. And this brings me to my next question. Where is the cardiac ganglion located?
Cardiac
Ganglion. It's called the cardiac ganglion of Risberg, and it has a relation to the aortic arc. So it's either anterior or posterior, superior, inferior. You have to say it like that.
According to the arch of aorta.
Yes.
Inferior to the arch of aorta and anterior to the that is pulmonary trunk, bifurcation of the pulmonary trunk.
Excellent answer. That's all.
Okay, Shunjit, so your
Okay,
seven
that's it from
questions. Yes. Okay, Shunjit, so your 7 questions are over. Thank you for participating in Anatomein. Okay, and wish you have a great future ahead. So you can now leave the call. Thank you.
Thank you very much.
Yes. Manish, you're not audible, Chiran. No, you're not audible. Yes, now audible. Yes, now audible. Okay, Chiran. So, Chiran, you're from Jimma Puducherry, right?
Yes, sir.
Oh, so you have been taking part in our quizzes for a long time?
Yes, sir.
Yes. Chiran, can you introduce yourself to our audience?
Sir, I'm Chera I'm actually born in Tamil Nadu. I studied until 7th standard in Malaysia, and my 8th, 9th, 10th I actually studied in Tamil Nadu, and 11th and 12th I actually studied in Andhra Pradesh. So now I'm currently studying first year in Jimma.
Okay, Chiran. Okay. So you'll be asked 7 questions, okay? And for each question, you get 30 seconds of time. So we shall start then.
Okay, sir.
Okay. So moving over to Shubham, so that you can ask the first question to Sharon.
Yes. Hi there, Sharon. My
Hi, sir.
question to you is, what is the difference between pro-patency and patent foramen ovale?
Sir, can you repeat?
Yes. What is the difference between pro-patency and patent foramen ovale?
Sir, so patent foramen ovale actually occurs whenever the septum secundum doesn't actually fuse with the septum primum. So there'll be a atrial septal defect. But in pro-patency, the septum secundum actually fuses, but there'll be a very minute opening such that a small probe can be inserted.
Yes, very good. And can you tell me what is the differentiating feature between the clinical manifestation of these two conditions, one being pro-patency and the other patent foramen ovale?
So in foramen ovale, since there is a shunting of blood, cyanosis can actually develop. But in pro-patency, there'll be no such conditions of cyanosis.
Right, very good. My final question, a bonus question. What is the name of the syndrome, which is the one you are saying about cyanosis? There's a specific name to that syndrome for patent foramen ovale. Can you name that?
Patent foramen ovale syndrome. Sir, I'm not sure about that, sir.
Right, very well answered. The answer to the last one was blue baby syndrome.
Okay, sir.
Okay. So Sharon, moving over to the second question. So Parijat, you can ask Sharon his second question.
Okay, so my question to you is, fallopian tube is covered by how many histological layers, and can you please name them?
Fallopian tube it is actually going to be covered by 3 layers. So we actually have the ciliated columnar epithelium, and underlying that we actually have the mucosa, and no, we have started the submucosa, and then surrounding that we actually have the serosa actually.
So what is the serosa called as?
The serosa is actually the broad ligament of the uterus.
Okay, and what is known as the mucosal layer? What is known as the mucosal layer?
Mucosal layer.
It has a specific name to it.
Specific name of the mucosal layer. Endometrium. Not sure, ma'am.
Okay. So
Okay.
Can you tell me PEG cells are found in which layer?
Ma'am?
Can you please tell me PEG cells or secretory cells are found in which layer of the fallopian tube?
Secretory cells are found in the column epithelial, column epithelial layer.
No, I'm asking about the layer, like mucosa, submucosa, or adventitia.
Oh, mucosa, submucosa. Not sure, ma'am, actually.
So that's it from my side. Well, nice attempt.
Okay, Sharon. Moving over to your third question. So Shorodip, ask him his third question.
Okay, Sharon. Hi. What is hydrocele?
Hydrocele is actually like accumulation of fluid in the scrotum.
Which layer?
Which layer? So there'll be this. So testis, and then there'll be surrounding this. There'll be the vaginalis.
Yes, you are going on the right direction.
Vaginalis. Vaginalis.
Can you tell the full name?
Tunica vaginalis.
Yes. You are correct. My next question is, so to remove fluid from the tunica vaginalis of testis, we have to use cannula. So can you just tell me the layers that cannula traverses to reach tunica vaginalis?
Oh, so there'll be a skin, and then there'll be a dartos fascia with the dartos muscles, and then there'll be external spermatic fascia, cremasteric fascia, and internal spermatic fascias.
Okay. Very good.
Okay, now Sharon, you'll be asked your fourth question. So moving over to Shampurna.
Hello,
Shampurna?
Steven.
Yes.
Yes. So my first question is, according to some theories, there is an organ in the human body which shows both open and closed type of circulation. Which organ is that?
Both open and closed circulation is the liver, ma'am.
It's not the liver. Would you like to try?
No, spleen.
Yes, it's the spleen. So if you're talking about the spleen, in the splenic circulation, after the splenic artery enters, it divides into certain branches. And then we have a very complicated circulation in the spleen, right? So could you tell me the arterial part of the circulation? No need to go into details about the venous part, just the arterial branches in sequence.
So actually there'll be this splenic artery, which has a tortuous course, and this enters the hilum and divides into a upper segmental and lower segmental artery. And in between these two segments, there is an avascular plane actually.
And then the branches within the spleen. I'm asking for the branches, the names of the branches within the spleen.
Names of the branches are, I'm not sure about the names.
It's okay. So if I were to say a compact and a diffuse type of spleen, what am I referring to? Like, why am I calling one compact? Why am I calling one diffuse? What am I referring to?
I'm sorry, can you repeat?
If I were to say compact and diffuse type of spleen, what am I referring to? Why am I calling them? Yes?
So in compact and diffuse means whenever the artery actually divides after it has entered the hilum, it's compact, and if it's before, it is diffuse.
Okay. Well done.
Okay.
So Sharon, your fifth question now. So moving over to Shrav, ask him his fifth question.
Hello, Chera.
Hello, sir.
We know that there is some structure known as the medullary rays in the medulla oblongata of the brain. Is there any other structure? Is there any other structure which also has medullary rays?
Medullary rays, medullary kidney, sir?
Yeah. So, do you know the structure that forms the medullary rays?
Medullary rays. It is actually formed by the. It is actually formed by one of the medullary rays. Cortical labyrinth and medullary rays.
No.
No, so actually the pyramids will form the renal pyramids will form the medullary rays.
Yeah. So, which part of the nephron forms the medulla?
Which part of the nephron forms the medulla? The not sure, sir.
Yeah. Is there any special name of the nephron which forms the medullary ray?
Oh, juxtamedullary nephron.
Yeah. So, can we extrapolate to that fact?
Extra. So the loop of Henle, since it is very long, it extends deeper, so it forms the medullary rays.
And is there any other vessel related to that?
The vasa recta.
Yeah. These two structures together form the medullary rays. Right.
So Cheran, you have 6 questions. Going over to Shubhanil.
So hi, Chera.
Hi, sir.
I'll be presenting to you a case, and then you'll have to listen to it carefully and then answer the follow-up questions. So
Okay,
the case is, a young man who had fallen off from a bicycle was brought to the emergency room with pain abdomen and was found to have not passed any urine in the last 24 hours. On clinical examination, there was edematous scrotum with tender swelling of the lower part of the abdominal wall. So this is the case. Now, your first question is, name the space that I am talking about here in the perineum.
Superficial perineal pouch, sir.
Very good. Next question. Name the content that is found in the superficial pouch but not in the deep pouch.
Name the content that is found this bulbospongiosus and ischiocavernosus muscles.
I'll give you a hint. It's a nerve and a vessel.
Or pudendal nerves.
No. You can have another guess.
Structure found in the superficial perineal pouch. Pudendal nerve. Sir, the posterior scrotal artery is posterior scrotal
Absolutely
nerves.
right. Absolutely right. And the last question from my side. Give the names of the 2 unpaired muscles contributing to the perineal body.
Perineal body to unpaired muscles. To unpaired muscles. The perineal body is. So one is ischiocavernosus.
No.
Ischiocavernosus. Superficial urethral sphincter. Sir, superficial urethral sphincter.
No, you are very close, but that's not the answer.
Oh, okay.
So your time's up. The next person.
Okay, Cheran, so your 6 questions are over and this is going to be your last question. So hear it carefully. So over to Shrutakirti, can you ask him a 7th question?
Yes. Hi. My first question would be, what is the sympathetic innervation of the heart? I want you to mention the levels of the nerves. Okay.
So sympathetic innervation is actually to the branches of T1 to T5 spinal segments, ma'am. So there'll be a superficial and deep cardiac plexus.
Okay. Okay, that's correct. And that brings me to my second question. Where is the cardiac ganglion located? I want you to answer with respect to the aortic arc, if you can.
So cardiac ganglion, one is actually the cardiac ganglion lies below the arch of aorta and above the left pulmonary artery.
Okay, yes, that will do. That's it.
Okay, Cheran, all your 7 questions are over. Thank you for participating in the quiz. Okay, and all the best for your future. Okay, Cheran, you can now leave the call.
Okay, thank you, sir. Thank you, ma'am.
Okay, thank you. So guys, we are over with all the 7 questions, and now I would ask the answers to the question. Those who have made the questions. So first, going over to Shubham. Shubham, can you tell the answer of your question?
Yes, hi there. I'm Shubham Nath, second year Mbbs from Medical College, Kolkata. The answers to my question were, the first one being patent foramen ovale is simply the absence of closure between the septum primum and septum secundum, while in the probe patency, there will be an incomplete fusion. Therefore, a probe can be passed between the 2 chambers. That is the first one. In the second one, the clinical manifestations will differ, as the probe patency will not show any clinical manifestations and can only be seen or investigated surgically, but the clinical manifestations will be seen in a baby with patent foramen ovale, in whom there will be cyanotic conditions, which is known as the blue baby syndrome. Thank you.
Okay, thank you, Shubham. Now going over to Parijat, tell the answer of your question.
Okay, so myself, Parijat Dey, I'm a second year MBBS student of Bardwan Medical College. So coming to the answers of my questions, I asked that how many histological layers does fallopian tube have? Fallopian tube is covered by 3 layers. Mesosalpinx, which is the peritoneal layer. It is also called as serosa. Myosalpinx, it contains smooth muscle and has 2 layers, inner circular and outer longitudinal. And the third one is endosalpinx, it is the mucosal layer. Now, this mucosal layer has the PEG cells, which are lined by non-ciliated epithelium and which help in the capacitation of sperms.
Okay, thank you, Parijat. Going over to Shorodip, please tell the answer of your question to everyone. Hello, Shorodip.
Hi, yes. This is Shorodip Rajput, currently studying in second year in Medical College, Kolkata. So my question was, what is hydrocele and what are the layers that we have to cross to reach the tunica vaginalis of the testis to clear the fluid with the help of cannula? So the answer is hydrocele is the accumulation of fluid in the tunica vaginalis of testis, and basically you have to cross the skin, dartos muscle, external spermatic fascia, cremostatic fascia, and internal spermatic fascia, and finally the parietal layer of the tunica vaginalis to reach the fluid.
Okay, thank you, Shoradeep. So going over to Shampurna so that she can tell the answer of her question to the audience.
Hello, I'm Shampuna Ghosh, pursuing second year of MBBS from Medical College, Kolkata. So my first question was, which organ in the body shows both open and closed type of circulation? The answer was spleen. So the explanation comes with the answer to my next question, which was about the splenic circulation. So in the splenic circulation, if we follow the splenic artery, it arises from the celiac trunk, it travels through the lienorenal ligament, where it has a pretty tortuous course, then it enters the spleen through the hilum. So here it divides into two branches first, the superior and the inferior, which will respectively supply the segments of the spleen, and in between the segments we will have the avascular spleen. After that, it has to divide into 5 or more hilar branches. These hilar branches will then enter into the trabeculum, which are basically extensions of the capsule of the spleen into its parenchyma. Then they will be called the trabecular branches. The trabecular branches will then enter into the parenchyma of the spleen. So here they will be in contact with the lymphocytes of the white pulp, and it is here that we will histologically observe the arterioles as the eccentric central arterioles, which is a salient feature of the histology of the spleen. They will then give straight branches, which are called the penicillar branches. The penicillar branches will have thickenings in their wall, which are called ellipsoids. These ellipsoids are actually part of the reticuloendothelial system and have a huge function in filtering out the older RBCs, because in the region of the ellipsoids, the lumen of the arteriole is quite narrow, as well as the macrophages are present. So thus the spleen earns its nickname of graveyard of RBCs. It will then open into the ampulla. So the ampulla is the region that explains why it is called the open circulation, because here the RBCs or the red pulp is directly in contact with the lymphocytes or the parenchyma. So there is no endothelium bordering it. So this is the region where it will be called open circulation. Before this, it was completely closed circulation. From the ampulla, it will go into the sinusoids, then into the venous system. So in the sinusoids, we will have some modified epithelial cells called staph cells. My next question was, what are diffuse and compact types of spleen? As some of the participants answered, it depends upon the branching pattern of the terminal branches of the splenic artery. So if the branches arise far away from the spleen and are quite long, the terminal branches of the artery, then it is called the diffuse type of spleen. Whereas if it arises very close to the hilum or almost in the hilum, and the terminal branches are short, we will call it the compact type of the spleen. Thank you.
Okay, thank you, Shampurna. Now going over to Shrav. Please tell the answer of your question to the audience.
Hello everyone, my name is Shaha and I am a second year MBBS student at IPGMER in NSSKM Hospital. My question was, is there any other structure other than the medulla of the midbrain, of the hindbrain, which has the medullary rays? And what structure from the medullary rays, and is there any special name of the nephron that forms the medullary rays? The answer will be the other structure that has medullary rays is the kidney of the abdomen. It is formed by the loops of the hilli and the accompanying vasa recta. The name of the nephron that forms the medullary rays are known as the juxtamedullary nephron. Thank you.
Okay, going over to Shubhranil, tell the answer.
Okay, so I am Shubhranil Mal, currently second year MBBS in Medical College, Kolkata. So my question was a case of a young person who had fallen off from a bicycle and presented to the ER with abdominal pain, no urination in the last 24 hours, scrotum has edema with tender swelling in the lower part of the abdominal wall. My first question was, what is the space that is involved? The space involved is a superficial perineal space or pouch. Second question, name the content that is a part of the superficial pouch but not of the deep pouch. The answer is posterior scrotal or posterior labial nerves and vessels. And for the last question, give the names of the two unpaired muscles contributing to the perineal body. The two names are the external anal sphincter or the sphincter ani externa, and secondly, the longitudinal muscle coat of the anal canal.
Thank you, Shubhranil. So going over to Shruta Kirti, please tell the answer of the last question to the audience.
Yes, so the first question was sympathetic innervation of the heart. Talking about the levels, it will obviously be from T1 to T5, as many of them have answered. And the preganglionic sympathetic nerves, which arise from T1 to T5, and the synapse somewhere in the upper thoracic ganglia and some in the cervical ganglia. And then the postganglionic fibers will form the sympathetic cardiac nerves, and they will innervate the heart. For my second question, that is the cardiac ganglion of the wristwork. So I wanted them to answer in relation with the aortic arc, and it is simply below and slightly in front of the aortic arc and to the right of the ligamentum arteriosus. That will be the answer.
Okay, thank you everyone for being the part of the quiz. We will disclose the winners very soon. Thank you. Good night to everyone. Okay. So hello guys. Now we have the winners of Anatomein. So I will announce the names one by one. So as second runners up, we have Savneet Gill from AIMS Rishikesh. As first runners up, we have Sarvesh from Jipmer Puducherry. And as the winner of Anatomein, we have Chera Cholapandian from Jipmer Puducherry. So congratulations to them on their success in Anatomein. So this has been a very big quiz today. So thank you guys for making the quiz such a big one. Meet you all in the next quiz, in which we will also arrange for a grand viva, and it will be taken by quizzical doctors. So those who have not followed quizzical doctors till now, follow us on Instagram. There in contacts, you will get the link of our WhatsApp groups. Join them and also subscribe to our YouTube channel, in which you will get a lot of exciting content which is coming soon. So see you all again. Good night.